My educational background started before that, but started in college, where I was privileged to go to an Ivy League college as the first person in my family really to go at that level or to go to college. My father was a college graduate. My mother had no money to go to college. So I studied psychology and sociology, which I loved. And my dad was a frustrated salesperson who had always wanted to be a doctor and couldn't be a doctor. He had no financial support. So he was leaning on me heavily to become a doctor. And the chairman of psychology was leaning on me heavily to become a PhD and apply to Harvard for psychology. I was a tad rebellious and didn't follow that advice, which was a career mistake at that time, but I was very young. But I loved sociology, so I decided to combine psychology and sociology and get my two interests allied. So then I applied to social work school. I was rebellious again because I was eager to come to New York, where my father had not wanted me to come for college. And I turned down some other schools where I got more money, but I got a National Merit Scholarship, I think, and came to Columbia. So I did my first placement in the welfare department, which was amazing because I had never been in a city. I hadn't been in bad neighborhoods. It was riddled with heroin at that time. And I was from Massachusetts. I mean, this is really unfamiliar to me. And then I was lucky to be placed at the New York Psychiatric Institute, which is a research institute, the first community psychiatry service, and that was all mental health. And from there, I just stayed in mental health the whole rest of my career. I've always had an interest in social justice issues, and the psychology part was what makes people tick. But I think my parents always had a great interest in people. My mother, who just recently passed away, she was the daughter of Russian immigrants. They came here, they couldn't read or write. My father, a frustrated non-doctor, managed baby crib factories, and he always took great interest in people and tried to help them if they had injuries and whatever. They were always very interested in people, but they had a great sense of liberal social values, and that's how I was raised. They were staunch Democrats, and so I was raised with a great sense. I also had some experience with anti-Semitism when I was a kid in Massachusetts as the only Jewish person in school. And then later I went to a small private high school in Connecticut, and I had anti-Semitism there too. So I think all of that just fostered my interest in social aspects and how they impact on people's personalities and functioning. In college, I did a summer job as assistant to a famous researcher, Sidney Brandon, who was doing research for Scotland and England. And he was doing community psychiatry research, and I was a psychology student in college. I mean, knew very little. But I was doing home visits for him, and I think that was my first exposure to mental health issues and also research. So I think that was a break in a way to get connected with a person like that. And his wife was a social worker, and I used to babysit for them. I think that was probably, I would consider, my first kind of exposure. I've organized voter registration campaigns in my hospital. I've really encouraged people to get health care. I've dealt with a lot of helping people deal with racial issues. So I think helping people get their lives back on track would be the thing. I've gotten awards, and that's very meaningful to me. The most professional award was a mentoring award named after Ellen Simon Perlman, who was a great, brilliant healthcare social worker whose writings about healthcare have stood up to time and are just totally current now, about staff burnout, about access to care, vital issues that she wrote maybe 5 or 10 years ago. And she died tragically of cancer too young, and her family established this award, and I'm the first person to get that award at the Society. That was very, very meaningful because I have spent a lot of my life mentoring social work students and young staff, and in the field. I've given a lot of time to people. But there's no price tag on helping people get better. And having the skills to do that is very, very meaningful to me. My first psychiatry person when I was a student was Alvin Mesnikoff. He was a maverick at started the first community psychiatry service at Psychiatric Institute. And my first week, we walked on to the service. I didn't even realize it was him. I was walking behind him with great anxiety. And we get into a clinical conference, and he's running the conference, and he calls on me and says, "What do you think of this patient that they were interviewing?" And of course, I fumbled. I knew nothing. And he was tough. He said, "Well, I want to know what your reactions, you have ideas, you have thoughts, I want to know what they are." So he was very, very influential as a psychiatry person. And then I was lucky. I had great mentors. Winnie Winnicus was an amazing person. And then Elizabeth Pritchard at Presbyterian Hospital, who's a medical social worker, but she hired me to overlook psychiatry and adult and child social worker in the main hospital. But she was an expert in thanatology, a brilliant woman, and very, very interested in mental health. So even though she was a medical social worker, she was a profoundly interesting and brilliant woman. And I've always been really lucky to have great social work colleagues that to this day I learn from. Carol Spiro, who worked for years in the psychiatry emergency room at New York Hospital and had to leave because of COVID. They didn't want her exposed to COVID, so she now does private practice in Great Barrington. Dr. Gail Monaco is an amazing clinician who worked at St. Vincent's Hospital and then worked for me at Payne Whitney in New York Hospital, then went into private practice. And she does a lot of work with a large gay population. She's an amazing person, deeply compassionate, and an amazing clinician. So I'm learning every day, and some wonderful doctors that I work with. And then I'd have to say my late husband, who is an amazing psychiatrist, psychoanalyst, a scholar on sexual orientation, a huge fan of social work, and a great writer. And before he died, he was going to shift from sexual orientation and more to the area of male aggression against women. I just learned tremendously from him, and he was a great supporter. My mom showed support in the early days of my career because she helped with childcare. I had a babysitter and a very supportive husband. But when I started I shifted from Presbyterian Hospital, where I had a kind of career upheaval there, and came to Cornell, where they hired me. And I just had a new baby. And so I had a babysitter, totally supportive husband, but a new big career. I was running a social work department. And my mom lived 20 minutes away and was very, very helpful to me. My father always championed, before his time, education for women. I mean, this is a long time ago. And actually, he was pushing me into medicine. I would like to be remembered professionally for helping so many patients get their lives back, for writing about stigma and mental health issues. There's still enormous stigma. Most recently, the mentally ill man that shot people on the subway. In my own network, I was very ashamed that someone called that person a nutcase, and I took offense and said we wouldn't say that about somebody with cancer or diabetes. So I've written a lot about stigma, family therapy, mental health issues. I'm a big believer in work-family balance, and I think it's hard to do this work and not have some happiness in your life. So I have always been a proponent of work-family balance and trying to help people not get so consumed by their career that they don't leave time for love in their life in some format. Doesn't have to be formal marriage, doesn't have to be having children, but making room for relationships in your life. So I would like that to be my legacy, and it would be for my grandchildren. And Tess is 6, Theo is 2.5. I have no idea what their paths are going to be, but I know they're being raised with values that are very important to me. And my granddaughter, when she was 5, was going to the mailbox and mailing voter registration cards. And I was really proud of her parents for instilling in that so young, and she knew what it was about. So that's what I hope my legacy will be. The advice I would give people going into the field is, first, I would tell them how much the field has changed. And I get people sent to me all the time by my friends asking them to talk to people about going into the field. And when I am asked to do that, I say I'm going to be very ruthlessly honest, that the field has changed a lot. I don't feel that the younger people in social work are being exposed to the mentors that I had, that I just mentioned to you, who were formative for me. Much is focused on regulations, which are very important. Chart notes, very important. I'm a maven on chart notes. But the focus is so much on that rather than on the humanistic aspects of why we went into this work. I would say that they have to go in really trying to reach out to people, because people aren't going to reach out to them so much. When I went to the national meetings, I was very impressed that some of the younger people there had a lot of mentorship around the country. So there may be more going on elsewhere than in my view in New York City, where I did see that people were encouraged to give talks and go to conferences, and that really heartened me, because that's not my experience the last few years at all. It's really been focused on productivity. And I'd say be open that you can learn from anybody. You can be a social worker, you can learn from doctors, you can learn from nurses, you can learn from an occupational therapist, you learn from your clients, and be really interdisciplinary, really open to that. And don't turn your nose down at a job that's not the perfect fit, because there's always people there that you can connect with. And I learned that actually from a professor at the School of Social Work who once advise that, to keep an open mind, even if it's not your perfect job that you're getting. And I would encourage people to press for better salaries. The national organizations need to get us paid better. People are doing very, very difficult work with the homeless, with opiate addiction, with mental illness, with palliative care, and grossly underpaid for what we do, which is why there's a brain drain and a defection, because people can't have a family. They can't live in urban areas with such low salaries. So it's very important to be connected to professional organizations and push them to work for you for that. And then I started the training at Columbia where they made us sort ourselves into casework, group work, and community organization. And I remember standing at the table. I was supposed to pick the pile, and I refused. I said, this is like ridiculous. We have to do everything. And so I never thought of myself just as a clinician. I always had my eye on organizing, advocacy, and I've done a lot of group therapy. I always push being eclectic and making sure that even if you do clinical work with a person or family, you always keep your eye on the social justice issues. And because that's the context people are living their lives. They're not insulated. I hope that the 3 or 4 mental health groups, psychiatry, social work, nursing, work better together. For example, the insurance companies are controlling the amount of care we can give. And you have people with no clinical experience at all questioning your judgment about why you think certain treatments are needed or certain interventions. And we can only change that if the organizations of all the professions get together and coalesce around this and are less guild-oriented. So I would encourage that for the future. And put as much energy into the social justice issues as we've put into the understanding of individual behavior, because that's what's shaping our context now, the guns, the drugs, the violence. You can do all you can to help people in their individual lives, but if they're surrounded by these issues which are not going away, I'm really praying that they get better over the next years. We haven't seen too much progress lately. If I were to describe my life with one word, which isn't so easy, integrity. I really honestly feel that I've never cheated on anything in my life. Years ago, I was studying Latin for 4 years in high school. And my father, well-meaning, a very ethical guy, was traveling through New Haven, and he picked up at the bookstore a translation of Virgil's Aeneid and brought it home to me. I was studying Aeneid. I never opened it. I just wouldn't do that. And he didn't mean that. He thought he was being just helpful and supportive. But I think integrity is really important to me, and I like to think that I never identify a problem that I don't offer to fix. So in my setting, I never finger point. I try to be supportive. I try to feel that people do their best. We all make mistakes. I've made mistakes. I try so hard not to make mistakes. But you can sometimes make a mistake. You apologize or you own it. And I never point fingers and say, you could have done this better, you could have done that. there but the grace of God go I. And I always offer to help. I don't just say, this isn't working out so well. I'd like to be remembered as a person that made a difference to her family and her profession.